Let's get started. So we have blood vessels. What's the job of the blood vessels? To carry basically the blood. We have big blood vessels, medium blood vessels, small blood vessels, and the very end of it is going to be the capillary. Let me see what it says in here. It's in here, right? Blood vessels, and it says in here arteries, right? And then it's going to end up with what? With capillaries, right? And it says in here where gas and nutrients and waste can be exchanged. So why do we need all this? This is going to be for capillary exchange. Now, how the blood vessels go? This is your heart. Your heart is going to pump the blood to your lungs. Here are your lungs. What is this name of this set of blood vessels that goes to your lungs and return your heart? As you can see here, it's like a circle. Therefore, since it goes to your lungs, this is going to be called the pulmonary circulation right here. Then the blood returns back to your heart, and from your heart, you're going to pump the blood to the rest of your body. So then what is the name of these blood vessels that take the blood all the way to your body and then returns the blood back to your heart? Systemic circulation. This one right here. Systemic circulation. Those are the two main types of circulation. It says in here coronary circulation. I'm not sure why they put coronary circulation, because that's the circulation in your heart. The heart is an organ, but if that's the case, then they should have put in here, right? Kidney circulation, liver circulation, spleen circulation, intestinal circulation, all of them, right? Because all of them are different types of circulation that happens in every single organ. So for the reason, I'm not saying that it's wrong, but I wouldn't have put that in here, because you're going to put that one, then you should put all the other circulations in there as well. Okay, so then the main type of circulation that we're going to have, let me systemic. I'm not saying those are the only ones, because you can see you have other ones in here, but they are not as critical as these other two. And pulmonary circulation. So if we go down here, we're going to see here major arteries of the body. Right? So then, that's basically blood vessels. Here you have all the names that you have in here. I'm going to try to show you that. Might as well take a look at graph. What is the blood vessel that takes the blood to your entire body? The aorta. So this one is the one that gets the blood with a lot of oxygen. This one right here. This part of the aorta that is going up, this is going to be called the ascending aorta. It's going to be called ascending because it's going up. Then we have the aortic arch, because in here it's going to make like an arch in here in order for the aorta to come down to your body. Okay, so then what are the different areas in your aorta? You have ascending aorta, aortic arch, and descending aorta. Now the descending aorta goes like this. So the descending aorta right here, this is your thorax. So this is going to be called the thoracic aorta. Since the aorta keeps coming down, but this is no longer your thorax, this is going to be your abdomen. So this one is going to be your abdominal aorta. That's abdominal aorta. This is thoracic aorta. The limit is going to be given to you by your diaphragm right here. What are the branches of the ascending aorta? Well, the ascending aorta is going to give you the branches that we said for the coronaries, right? So then the branches of the ascending aorta are going to be the coronaries. Then after that, we have the arch. Okay, right here. If you look at this, we're going to divide it in half like that. We're going to need branches for the head and branches right here for the arm. Right? If you just put your arms like this, then you can see what I'm saying, right? So you need branches here for the arm and you need branches for the head. Now, since we are dividing this in two, then we need branches for the right side of the head and the right arm, and we need branches for the left side of the head and the left arm. The thing that we have to keep in mind, or that you need to understand in here, is that for the left side, we get one for the arm and one for the brain, but for the right side, that's not the case. For the right side, you get only one like that, and this one is the one that actually eventually is going to give you the one for the head and the one for the arm. So even though we need 4 blood vessels, the arch only gives you 3. The one for the arm on the left side, the one for the head on the left side, but for the right side is going to give you this trunk right here. The brachiocephalic trunk is the one that gives you the branches, the right one for the head and the right one for the arm. Now, if you look at this, what bone is this one? This is your clavicle right there. That's your clavicle. The branch that goes to your arm is going to go basically behind your clavicle, and it's going to hide behind it to get protection, right? That's the job of the bone, right? To protect. So it's going to go under the clavicle right there in order to get into your arm. So therefore, what is going to be the name of this one? Then it's going to be called the left subclavian because it goes kind of like behind and under your clavicle. Left subclavian. What is this one going to the head? This one is going to be called the common carotid. Every single time you have in the name common is because it's going to give you two branches. These two branches are always going to be the internal carotid, external carotid. For the right side, we're going to get brachiocephalic trunk. And the brachiocephalic trunk is going to give you the right common carotid and the right subclavian that will go to your arm. So then how many branches from the aortic arch? 3, which are going to be the left subclavian, left common carotid, and the brachiocephalic trunk for the right side. With those branches, then basically you can understand that we're going to take care of everything that is in here, right? Everything that is the head, the neck, and we took care of the arms too. Now we need to take a look at the thorax. So in the thorax, we have that descending aorta. And we said that this part of the aorta is going to be the thoracic aorta. So then what is the job of the blood vessels? To provide blood to the organs. Okay, so then what organ you have in here? Your lungs. So it's going to give you a branch for your lungs. Bronchial artery. What else do you have in here? Right here you have, for example, the esophagus. Okay. You also have your trachea, right? So then what your aorta is going to do? Well, it's going to give you the tracheal artery for your tracheal, your esophageal artery for your esophagus. Now you go to the abdomen. So then what do you have in here? Kidneys. Okay, well, it's going to give you a branch, the renal artery. This part right there, showing you 3 branches in there. You guys see it like that? The celiac trunk is the one that gives you the branches for this. It's going to give you the splenic artery, the gastric artery, okay, hepatic artery. Those are going to branches from there. What other organs we have in there? We have the intestines. Okay, we have 2 intestines. We have the large intestine and the small intestine. The superior and inferior mesenteric will take care of your large intestine, your small intestine. Right? If you really think about that, then that's basically all the organs that we have in the abdomen. But what happens in here, guys, is the following. Here's your pelvis, and here's your legs, right? Here's one leg, and here's your other leg. So now we have the problem that we have only one aorta, but we have 2 legs. So right here, your aorta needs to branch out and give you 1 blood vessel for the right leg and 1 blood vessel for the left leg right there. So then right here, we have these 2 branches. This one goes over here, and this one goes over here like that. Okay, these branches right here are going to be called the common iliac arteries right there. Since you're going to have 2, one is going to be called the right common iliac, and the other one is going to be the left common iliac. The common iliac is going to give branches right here to the inside, right there, internal iliac. And the one that continues towards your leg is going to be the external iliac. Branches of the internal iliac, branches for the uterus, branches for the penis, branches for the urinary bladder, for the prostate, for the fallopian tubes, for everything, except the testicles and the ovaries. So this is the ovary, let's say. Okay, right there. So even though the ovary is in the pelvis, the ovary doesn't get blood from the internal iliac. The ovaries are going to get branches from the abdominal aorta. So this blood vessel right here is going to go from here, and from all the way up here, it's going to start coming down like that, and it's going to give branches to your ovaries. Same thing happens with the testicle. So let's say the testicle is down here. So this gonadal artery will come from here all the way down here to provide blood to the testicles. If we look at the legs, this is going to be external iliac, and it's going to give you the femoral artery right there. So remember that external iliac is in the front, right? The femoral artery is kind of in the front too, but the popliteal artery is not. The popliteal artery goes to the back. The popliteal artery is going to give you branches to the posterior tibial, the anterior tibial. Okay, so then those are going to be the blood vessels for your legs. Okay, let's continue with it. So then if we go back over here, we talk about the common carotid that is going to give you internal and external carotid. It's called internal. So where do you think goes? Well, to the inside of your head, right? to provide blood to your brain and different structures that you have in your brain. The external carotid will go to the external part of your skin, and this is this one right here. And this one, right, those are branches of external carotid. This one right here is a temporal artery. Okay, so then now the one that goes to your arm is going to be the subclavian, right? The subclavian is going to give you a branch right here. This is a circumflex artery right there, and then from here it comes down here. It's going to give you the brachial artery, which is this one right here. The brachial artery is the common artery that people use in order to take the blood pressure, for example. What branches the brachial artery is going to give you? It's going to give you two, the radial artery and the ulnar artery. This is going to be called the palmar arch right here. Palmar arch right there. In here you have some specific views of what I already explained. What is the name of this? This is the brachiocephalic trunk. It's going to give you subclavian, common carotid, internal carotid goes inside, external carotid goes outside. The internal carotid is the one that is going to come over here. Right here, you see that? Internal carotid right there. This is the base of your brain. There's something called cerebral arterial cycle. In most of the books, you're gonna see that as the circle of Willis. You see, basically there's a circle in there, that right there. So the anterior communicating arteries, the posterior communicating arteries are gonna give you the circle of Willis. Right here, this is what we talked about already, right? Brachial artery, radial artery, ulnar artery, cover that. Right here, we talk about the celiac trunk. Right here, you have the external iliac, right? It's gonna give you branches to your leg.